Chapter 11 for the textbook that I am currently using covers a lot of the muscles that you are going to learn in your lab. So I'm going to leave most of that for you to learn in lab, and I'm going to focus on a very limited bit of content from Chapter 11, which will include some introductory terminology, classification, and naming of muscles, but the biggest part of this little abbreviated discussion will concern muscle disorders. So we'll begin by looking at some of the terminology associated with muscles. So to begin with, you should have learned already about connective tissues, and when you learned that, hopefully you also heard about some of the structures associated with muscle, including a tendon, which is connective tissue that attaches a muscle to bone, skin, or to another muscle. An aponeurosis is the same thing as a tendon, but it's flat and it forms a sheet, where a tendon is more like a cord or a rope. An aponeurosis is a thin, flat sheet of that connective tissue that does the same thing. It connects muscle to bone, skin, or another muscle. Oh, sorry, my slide advanced right quick. Let me get us back where we need to be. Okay, so most muscles will cross at least one movable joint. So when that muscle contracts, one bone is going to move and the other one's not. So when we talk about these attachments for muscles in the axial skeleton and the muscles associated with those, we have superior and inferior attachments. Taking you back to terminology, right? But the superior end is usually more movable, and the inferior end is usually the one that is much less movable. Now, if we talk about the muscles associated with the appendicular skeleton, that's reversed. So the proximal attachment, remember, closer to the body, is more movable, or I'm sorry, less movable because it's attaching something to the body. And the distal end is usually the end that is going to move more. So again, I want you to think about your biceps brachii, your gun show, right? Your arm muscle that we flex and show how big our muscle is. So that muscle, if it is going to pull your forearm toward your shoulder when you flex, then you're going to have to attach across the elbow joint because that's the joint that is going to move to bring the forearm up. So you're going to have a distal attachment that is going to be farther away from the point that the muscle attaches to the body or the limb attaches to the body, and then the distal attachment farther away, proximal closer. Shouldn't be anything new there. You've heard these terms. So let's look at that exact muscle. So here is your biceps brachii. Now a couple of things here. Notice I'm not just saying biceps. That's because you have more than one biceps. Yeah, biceps simply means two heads. But notice I'm saying biceps brachii. That tells you it is the two-headed muscle in the arm because brachii refers to arm. The other thing, did you notice that I say biceps and not bicep? Bicep, you're saying two head? No, biceps, two heads. All right, so now you've got a lesson in how to say the word. All right, so let's look. Your proximal attachment for the biceps brachii are on the scapula. The distal attachment is on is right there on the radial tuberosity. Now, when that muscle contracts, look how the fibers are running. They're running longitudinally, right? So elongated fibers running from the proximal end to the distal end. So when this muscle contracts, the fibers are going to shorten just like this, right? So they're going to shorten, and that's why the muscle pooches up. But that is pulling on both of these bones. Which one moves? Exactly. The lower arm, the forearm, moves toward the shoulder. The shoulder does not move toward the forearm. So the terms that we use for those two muscle attachments are origin and insertion, okay? So the origin is always going to be the end of the muscle that attaches to the bone that does not move when that muscle contracts. The insertion is going to be the end that attaches to the bone that moves when that muscle contracts. Now, there are several of these you're going to have to know for lab. you should look in your lab manual, or I'm sorry, in your Canvas, and some of the PDFs in there should have a list in table form of the muscles that you need to know: origin, action, and insertion. Now, we just talked about origin and insertion. Let me give you a little tip for figuring out the action if you forget. Okay? Now remember, you only have to know the ones that we have listed on that table. But I want you to look again at the biceps brachii. There's the insertion. There is the origin. Look at the orientation of the fibers running parallel with the long axis of that muscle. So think about how sarcomeres shorten. When they shorten, they're going to shorten the same way those muscle fibers run. I'm sorry, my mouse is acting wonky today. So it's going to shorten just like this, right? So what is that going to do? It's going to pull on these two attachments. All you have to do is think about it on your own body. When that muscle contracts and pulls on the origin and the insertion, which one moves? Well, the one that moves is the forearm. Well, what is the action? It is decreasing the angle of the joint, so that is called flexion. So origin on the scapula, insertion on the radius, action, flex the forearm. Now remember when we looked at the structure of muscles, and we had muscle fibers, which are muscle cells, bundled together to make fascicles. When you look at a muscle, you're not actually seeing the muscle fibers, you are seeing fascicles. So just like I mentioned a while ago on the biceps brachii, and I said, see the muscle fibers running in this orientation? You really were seeing the fascicles, but if the fascicles run longitudinally, the muscle fibers within it run longitudinally. Okay, so let's take a look at some of these. So we have circular muscles, such as the orbicularis oris around the mouth and orbicularis oculi around the eye. When you have a circular muscle and it contracts, it makes the circle smaller. So that creates a sphincter muscle that controls opening and closing. Parallel muscles, very much like we saw on the biceps brachii, we also see on a lot of the thigh muscles. So the fascicles run parallel to the muscle's long axis. Now, sometimes, like you saw with the biceps brachii, they will have that extended belly portion. These muscles have very high endurance and they tire very slowly. Convergent muscles are where the muscle fibers inside the fascicles, of course, all converge at a point. So it's sort of like a fan. You have a wider area and then it all converges at a common attachment site. Now this allows for muscle to pull in various directions, but not with as much strength of contraction as you have in those parallel muscles. So notice where we're looking at one of our convergent muscles right here on the pectoralis major. Now, this will be one of the major muscles that you'll see when you learn the muscles of the chest. We also have something called pinnate muscles. I don't know if I have another slide. Let me check right quick. Yeah, here we go. So pinnate is sort of like a feather. The fascicles are arranged like they're a feather. So the fibers can pull at an angle to the tendon. Now, this generates more tension, but it doesn't pull the tendons as far as those parallel muscles because it's pulling onto the tendon in an angle or at an angle more so than pulling straight. So we have three subtypes of the pinnates. That is unipinnate. What does uni mean? One, absolutely. So the fascicles are on one side of the tendon. Bipinnate, you know what bi means. Bi is two. So that is what we have with the rectus femoris. Rectus femoris is one of our thigh muscles, remember? You have fascicles on both sides. Now, if you look at this, you can see they're running obliquely to that tendon. This is the most common form of pinnate muscle. And then the multipinnate is what we have with the deltoid. So we have branches of the tendon within the muscle. Here you can see two of those branches on the anterior surface. And those fascicles are arranged around each side of each branch of that tendon. So multiple feathers multipinnate. We also group muscles by their actions. So an agonist is the prime mover of a muscle. So if you think about it, the triceps brachii, which is your posterior muscle, right? So right here's your triceps brachii, right here's your biceps brachii. Your triceps brachii is the agonist or the prime mover for extending the forearm. Now we just talked about the biceps brachii going to flex the forearm, so it is antagonistic to the triceps. So these two muscles always have opposite action, agonist and antagonist. Agonist moves in one direction, antagonist moves in the other. I think of this like a seesaw. So one side goes up, the other side goes down. Well, if the agonist here, the triceps brachii, is contracting, that is extending or straightening the arm. The antagonist for that movement is the biceps brachii. When it contracts, it flexes the forearm, so that is the opposite action of extension. Now, a synergist is a helper. Muscles that have big actions very often will have synergistic muscles. So a synergist helps something to happen. For instance, if I want to go out and pick up my car, well, by myself, I might get the bumper to wiggle up and down a little bit, but I'm not going to pick that car up. But if I took several of you guys out to the parking lot with me and we all spread out around, we could probably pretty easily pick up my little Mini Cooper because it's not very heavy. But by myself, I couldn't do it. Synergistically, we could all put our force into that raising my car. So the synergist for forearm extension and, of course, the contraction as well is going to be the brachialis. So the brachialis is deep to the biceps brachii, so it contributes to the action to flex that elbow joint. Now, a lot of your synergists also are simply going to be fixators, which help to stabilize a joint. Very often, skeletal muscles are named based on something about their appearance, where they're found, or their action. So muscle action, of course, is going to tell you what the muscle does. So if you see flexor, well, it's going to flex something. The rest of it's going to tell you what it flexes. So the flexor digitorum flexes the digits, and it's a long muscle. That tells us something else about it, right? Now, specific body areas indicate muscle location. Sorry, guys, my clothes dryer just went off. The rectus femoris. Well, rectus doesn't tell us where it is because rectus does not refer to something with colon, okay? The word rectus means straight. Again, that's telling us about the fibers. But femur, rectus femoris, that tells you it is a straight muscle near the femur, so it's going to be a thigh muscle. The muscle attachments that we talked about just a minute ago indicate origins and or insertions. For instance, the sternocleidomastoid originates on the sternum and the clavicle. Now look at that. Sternocleido, sternum, clavicle. And it inserts on the mastoid process right behind your ear. Now, if you want to see what that muscle does, put your finger on your mastoid process. So on one hand, go to your mastoid process right behind your ear, and then find that muscle. Turn your head to the side. Find that obliquely running muscle that starts right there at that mastoid and runs down toward the clavicle and the sternum. That is your sternocleidomastoid. So when you turn your head, that muscle is doing what? It's pooching out. So the sternocleidomastoid helps in rotation of the head. All right. Now, we also have orientation of muscle fibers. I gave you this one just a minute ago, right? The rectus abdominis. Rectus means straight. This is your six-pack muscle of the abdomen. Whoop, went one too far there. We also name muscles based on their shape. The deltoid, which is your shoulder muscle, is an upside-down triangle. Well, upside-down triangle is delta. Okay, or a triangle is delta. We just turn it upside down so that we're looking at it in a different orientation if you're looking at the deltoid. So the wide part of the triangle would be at the shoulder end. The pointy part of the triangle would insert on the humerus. The abductor pollicis longus. Well, where do you see anything about shape there? Well, abductor tells you what it is. Pollicis tells you what it abducts. Longus tells you it's a long muscle. Don't you love it when things make sense? This is why, guys, I am constantly telling my students, look at the words. In anatomy and physiology, very often, the words are going to give you information. And sometimes if you've got a big word or big term that you don't know, a big phrase, look for pieces in it that you do know. Okay? If you looked at this, abductor pollicis longus, the only thing you might know is long. But if I was asking you, what is the criteria for naming this muscle? Muscle shape. It's long. Look at the words. Look at the words. Sometimes it's the size of the muscle. The gluteus maximus, gluteus minimus, gluteus medius. Well, that tells you the size of the buttocks muscles. Maximus is biggest. Minimus is the smallest. Medius, you got it. It's the middle. All right, the number of muscle heads at an attachment site is used frequently as well. So the number of muscle bellies or heads. Okay, so the triceps brachii has 3 heads. Biceps brachii, of course, 2 heads. All right, let's wrap this up by looking at a few of these. So muscle action, abductor, okay? Abductor moves something away from the body. Adductor brings something to the body. Flexor brings a joint to where the angle is less, so you flex your forearm, then you extend that forearm, an extensor muscle and a flexor muscle. Body regions, oh, there's tons of these. Okay, let's look at orbicularis oris. Orb, circle, oris, around the eye. Okay. Semispinalis cervicus, cervicus of the neck. Brachii, arm. Carpi, wrist. Flexor tells you action. Ulnaris tells you it's on the ulnar side of the arm. All right, so you can read through these. Muscle attachments, we just did sternocleidomastoid. But what about intercostal? Inter, between, costal, ribs. Yeah, all right, you're getting it. Orientation, oblique at an angle, orbicularis, circular, rectus, straight. Muscle shape, well, we talked about the deltoid. The quadratus is a rectangle. Trapezius is a trapezoid. Okay, then we've got longus and brevis. Long muscle, short muscle, it's brief. Yeah, you get it. All right, muscle size, major is big, minor is small. We did the other 3 already. And then the number of heads, biceps, triceps, quadriceps, 2, 3, and 4 heads.